Hey guys, welcome back to my YouTube channel. Hope you guys are doing great. In today's video, I'll be talking about the challenges faced by male maternal healthcare providers or male midwives and some tips on how to overcome these challenges. But please, if you're just coming into my YouTube channel for the very first time, please subscribe and turn on the bell icon so you won't miss any of my upcoming videos. Okay, before we move to those challenges and some tips on how to overcome these challenges, I would like for you all to be aware about 3 important facts. The first fact is that before the 17th century, midwifery or the birthing process was an all-woman affair. In fact, midwifery was being defined as a female midwife attending to a pregnant woman. And the second fact is that the Royal College of Midwives in 1951, they said midwives give intimate care, and such a care will not be acknowledged by the public or pregnant women if this care is coming from male midwives. So the third point is that it was only after the Sex Discrimination Act in 1975 that men in the UK were allowed to train and become male midwives. So it is important for us to be aware that the challenges faced by male maternal healthcare providers today all have a deep historical background, and most of these challenges are societal. So that being said, I'll be talking to you all today about the 3 most common challenges that are being faced by male midwives or male maternal healthcare providers. The first challenge is about religious or cultural beliefs of some pregnant women about being seen naked by any man other than their husbands. So for you to overcome this challenge as a male midwife, you need to understand that in the midwifery profession, a midwife needs to work in partnership with every woman, respecting the individual circumstances and the views of this woman. So in an institution where there's the availability of both the male and the female midwives, then you definitely need to offer this woman the choice of a female midwife. But in an institution or in rural areas where there's just the availability of sometimes a single male midwife, then you need to educate and counsel this woman. You need to introduce yourself to her. You need to educate her on every procedure and give rationales about those procedures. You need to get her comfortable because it's all about building an environment of trust and comfort. You can even propose to her if she would like a carer of hers or her spouse or someone of the opposite sex to be with her in the labor room during your routine examinations. So this is a key point on how to overcome these challenges when it comes to the beliefs or the religious beliefs or cultural beliefs of any woman or pregnant woman. The second challenge is about attending to a woman or a pregnant woman who has a past history of sexual or physical abuse. Before you overcome this challenge as a male midwife, you need to understand that in the midwifery profession, midwives need to work in collaboration with other midwives and with other health professionals like counselors in order to provide holistic care that will meet the needs of each woman. So in such a case, you already have it at the back of your mind that this woman has a past history of mental and physical trauma. So you need to offer holistic care to this woman because midwifery is a holistic profession. Holistic means you don't just attend to her physical needs, but you also attend to her mental needs as well. This woman was probably raped in an isolated environment where there was no one to help her. So it is but natural or normal for you to propose that someone of the opposite sex, be it a carer, to be with her in the labor room during routine examinations. And you need to be gentle and patient when delivering care to this woman. And you need to be organized as well. If she is in labor, for example, don't be quick to doing a vaginal examination. You want to start by monitoring her vital signs, performing your Lopez maneuver, and discussing with her in the process, and also trying to maintain her privacy as much as possible. What do I mean by maintain her privacy? If you are working on her abdomen, that's you're performing those palpations and auscultations, then it's but natural that you get a sheet to cover her vulva. You cover her downward so she will not be exposed. Get her comfortable and build an environment of trust. And the third challenge is that most pregnant women or women in the maternity, that's women who come for care, they expect a lot from you as a male maternal health care provider. They expect you to be more gentle, more patient, and sympathetic. Some will even want you to stand by them throughout the labor process. But you as a midwife, you also need to understand that in the midwifery profession, you need to promote the ability of each woman to be able to take care of themselves. Yes, you will be there for her as a midwife to guide her and be with her, but you also need to promote her personal capabilities of taking care of herself while you are taking care of her. So guys, these are some of the challenges that most male midwives face in the health field concerning midwifery. And these challenges, to be honest, most of them will have to do with those women expecting a lot from you as a male maternal health care provider. Because in the 21st century today, most women, be it Muslims or not, religious or cultural beliefs, they are beginning to be more comfortable with the male midwives because they believe we are more caring, we are more sympathetic. So these challenges are not as many as they used to be before this 21st century. So guys, I hope this video was helpful. Please don't forget to comment below and tell me what you think. And please don't forget to subscribe and turn on the bell icon so you won't miss any of my upcoming videos. This has been Boris the Midwife. Your health is my priority. See you in my next video.